Welcome back. Now, if you sometimes feel like you're losing your balance because the world around you is spinning, it may be more than just a hangover. You might be suffering from a condition commonly called vertigo. Now, to shed more light on this condition, we are now joined in the studio by Dr. Yan Aro Lopez, an ear, nose, and throat specialist from the Medical City. Good morning, Doc.
Hi, good morning, Paolo.
Vertigo, this is a new buzzword now. I mean, dati nahihilo ko, yun lang tinatawag dyan eh. But
Yeah.
I mean, now it's been named, it's been labeled, and it's a condition that's actually maybe more common than we might think.
Yes.
You know, oftentimes when you do describe a sensation of feeling dizzy or the world is spinning, you don't quite know how to describe it, but it's actually a fairly common condition called vertigo. I mean, let's start with a definition of terms maybe. What exactly is vertigo?
Well, sometimes we use the word dizzy spell. It's a spin sensation. It's an illusion of movement. Maybe the environment is moving around you, or you yourself, are moving in relation to your environment or space.
Okay, so those are two different sensations.
Yes.
You can feel like it's the world that's moving, or you can feel like you're the one spinning around in space. Either way, I believe one is subjective vertigo and the other is objective vertigo.
Yes.
It's vertigo nonetheless.
Yes, both
and
are the same.
it's a condition that is often caused by many things actually. What are some of the things that can give you vertigo?
An inflammation of the nerve, of the vestibular nerve. We call it vestibular neuronitis.
Okay.
And then,
wow, it sounds complicated.
Yes. And positional vertigo, which is basically there appears to be sludging or nakakaroon ng mga bato-bato doon sa semicircular canals. And so what happens is this incites movement in the semicircular canals and creates a sensation of spin or vertigo.
Are we just talking about? I mean, usually balance and the sensation of being balanced or unbalanced is often related to your ear, your inner ear. Is it more than just maduming tenga lang ba to? Is this just dirty ears? Is that related or?
In layman's terms, dirty ears equals puno ng tutule.
Okay.
We're talking about the inner ear in this case. You have sludge or deposition of stones, bato-bato, in your semicircular canals.
Okay.
And so this creates the spin sensation whenever those move around in your canal.
Okay. The formation of things like that, is that related to specific diseases, specific conditions that cause the problem?
Well, there have been reports of positional vertigo related to post-traumatic events after surgery, after infection, and sometimes they just do happen because of the typical wear and tear in your body.
Okay. Are certain people more likely to experience vertigo? I mean, I often hear more mature or elderly people complain about vertigo, or I can't leave the house without my vertigo medicine, or hindi ako pwedeng lumabas today and have vertigo ako. You often hear that. Are elder people more prone to dizzy spells or vertigo, or does it affect everybody?
Yes and no. When you reach a certain point in your life, like your middle age, there is the wear and tear factor.
Okay.
You probably will have diabetes. You probably will have vascular insufficiency. You probably will have had some form of trauma or insult, and all of these can incite vertigo.
Okay, you talked about the formation of debris or bato-bato as you called it in the inner ear, but there are certain diseases. Meniere's disease.
Oh, Meniere's disease. Yes.
What are we talking about here?
Well, Meniere's disease is a syndromic disease. You have basically a patient who has dizzy spells, and then has ringing in the ears, which we call tinnitus or tinnitus, and then hearing loss.
Okay.
And these usually occur in people who may have had no prior ear problems. And it just happens.
Okay.
And the truth of the matter is, we don't even know the exact cause up to this point in time.
Okay. Other growths like tumors, acoustic neuroma is another possible culprit.
Acoustic neuroma can give you hearing loss.
Okay.
Vestibular nerve tumors can give you also dizziness.
Okay, so that I mean that's we're talking about growth in your inner ear. I mean
The
those
tumors
are things,
can.
yeah, tumors that
Yeah,
can actually
tumors
throw
can.
off your balance. Accidents maybe
Yes.
if you've had trauma,
Post-traumatic
yeah,
syndrome.
to your neck and your head.
Even tumors in your brain, in your cerebellum, can give rise to imbalances.
To imbalances.
And strokes can also, or infarcts in your brain can
Okay.
also cause dizzy spells.
Okay, are people who have high blood pressure at risk here? Is that an associated condition?
If you look at hypertension as a form of vascular insult and it affects parts of your vestibular pathway, then it can manifest as a dizzy spell.
Right, and I know that this also can come from people who often have headaches, who have regular migraines and that sort of thing. Also related, perhaps?
Yes, in a way. Migraine is a vascular headache, and it can present as a vertigo as a form of migraine equivalent.
Okay. Okay, so how do we recognize whether we're just we're just having a bad day, or it's actually a case of vertigo? I mean, yung konting hilo lang ba vertigo na ba yan? How do we at what point do we actually say, okay, you've got a vertigo problem or a case of vertigo?
Okay. Usually we go by the history of the patient, and let's say vestibular neuronitis. Usually the history goes like this. Several weeks before, had a bad cold.
Okay.
May or may not have had fever or upper respiratory tract, symptoms. Then several weeks down the road, he or she wakes up, unable to stand up,
Okay.
not even move the head, fully nauseous and vomiting, and hilong-hilo.
So
Rush
the
to the
vomiting and
emergency
the
room.
nausea, this is because you
Usually
feel
an
dizzy. I mean,
accompaniment.
this is because you feel
Yeah,
dizzy. Much like the
yes.
same way if you rode a roller coaster
Right.
or turned around in a circle, nahihilo ka and you'll eventually feel nauseous and you may even throw up. And so it's the same thing. You have that sensation, so you do get nauseous and vomit.
And then you have some laboratories that you can request for. So if you're considering that this is positional vertigo,
Okay.
you can do a Dix-Hallpike maneuver,
Okay.
or you could also do visual nystagmography in the hearing and laboratory balance laboratory.
All right. Okay. So once you've how would you say confirmed that you've got this condition, what should we be doing? I mean, how do we usually go about addressing the problem?
You mean treatment?
Treatment.
Okay. For BPPV, the response to
PPPV is
positional vertigo. Yeah.
Okay.
The response to drugs is disappointing.
Okay.
What we recommend would be liberatory maneuvers.
Okay.
If you will allow me to demonstrate on my own,
Okay.
the patient is instructed to lie on the edge of the bed and then bring himself to a supine position like so.
Okay.
Hold it for a few seconds
Alright.
and then go up and then move to the other side.
Di ba mas nakakahilo yan, Doc? I
Well,
mean,
you actually habituate yourself.
okay.
You liberate, you allow the sludge to walk away from where it is
Okay.
and redistribute into the semicircular canals.
Okay.
By jarring your
So this
semicircular
is a condition
canals.
where maybe you wake up feeling a little off or
That's the usual
at
history.
some point during usually you're lying down and things settle where they're not supposed to settle. I mean, I'm assuming that's the
You
problem.
wake up and then hiluna,
Okay.
or rolling from side to side in the bed, or bending over or looking up into the ceiling causes vertigo. Or some people will even say, I cannot stand being shampooed anymore in the salon.
Or when you have to lean
Yes,
back.
yes.
Okay.
Or I cannot even hang clothes
Okay.
because you have to look up.
Okay. What are some of the other strategies that people with positional vertigo can do? I
Well,
mean,
there are other habituation exercises whereby you basically train your eyes and you do eye exercises so that the impact of the vertigo will be lessened.
Okay. So this is classic things like when you're dizzy, like if you're on a boat, like tingnan ka sa malayo. Look at
Well,
look at
you
distant
can
things.
fixate actually, but there are exercises, eye exercises, like looking, to and fro from side to side,
Okay.
up and down, in several sets. We call them habituation exercises. There may be a role for some form of treatment especially in vestibular neuronitis,
Okay.
especially in the acute phase. You may be able to tide the patient over by giving them several days of vestibular suppressants.
Okay.
So that
We're
they
talking
won't-
drugs. All
Yes.
right, we're talking drugs here.
Most people, most specialists won't give. Well, they say it's not logical to give drugs for vertigo because then you are not allowing the compensatory mechanism to set in. Kaya lang, kung hilong-hilo yung pasyente, no, cannot function, I think that giving them a couple of days of anti-vertigo medicine won't be harmful. Just so they can function.
Anti-vertigo medicine, this is different from just the usual stuff you might take, like those pills you might take, like if you're one of those people, a bad traveler, a dizzy traveler. Are these different?
The same.
The same?
The same. We're talking about antihistamines which cross the blood-brain barrier. Examples would be diphenhydramine or dimenhydrinate and meclizine.
Okay.
I cannot mention the proprietary names.
I mean, there are a lot of brands out there, but I think we all know what we're talking about. I mean, yung mga people na biyahilo, di ba? Yung mga people
you can take them.
You can take that, and that sometimes helps. Now,
Yeah.
when do you know that it may be, or should you be worried that it's a more serious condition? I mean, some people might be at home and say, yeah, I do experience that when I wake up, and I'm going to try that.
Exactly.
So, lying from one side to the other side.
I see your point.
And maybe it helps. And maybe they might just take one of those types of pills. But when do you know it's something a little more serious and something that you may want to seek a professional's opinion on?
If you have more than vertigo, positional vertigo by definition is just pure vertigo.
Okay.
The moment you have associated hearing loss or any form of weakness or eye signs, slurring of speech,
Okay.
Or dimness, yung blackout spells, you may need more detailed evaluation.
Okay.
Neurologic, ophthalmologic.
Simply because it may be a more serious case of vertigo,
Yes.
or it may be related to much more serious conditions like a stroke, a possible stroke,
Tumor,
and that sort of
and
thing.
vascular insufficiency.
All right, sounds good. So the first thing you must do is make sure, make sure that identify the condition. Really,
Yes.
I mean, know that you
Seek
have
professional help.
professional help. Know that you have possibly have this condition called vertigo. There are things you can do to treat it, but the condition could be far more serious than you may think. So always seek professional help when in doubt. Right.
Yes.
All right. Well, thanks so much for joining
Thank
us
you,
and giving
Paolo.
us the lowdown
Thank
on
you.
this, Doc. Thank you so much to Dr. Yan Aro Lopez from the Medical City, rather. Thank you so much, Doc.
Thank you.